Hi, I'm Dr. Scott Jahn with another episode of Research That Matters TV. A woman's body undergoes many transformations during the 9 months of pregnancy. Some of these changes are visible, such as an expanding belly, while others, such as morning sickness and backaches, may not be as visible, but equally known. Then, there are the few body changes that may be unexpected and catch some women by surprise. For example, during pregnancy, a woman's nutritional needs change. Increased key nutrients such as folate, iodine, iron, and water, just to name a few. It is for these reasons that the first step to a healthy pregnancy is to ensure adequate nutrition so that your child has every advantage to develop. Prenatal vitamins should be started about a month before you plan to conceive in order to build up in your system. A good prenatal should contain the following: 600 micrograms a day of folic acid. Folic acid reduces the risk of neural tube defects and spina bifida, which is a leading cause of paralysis in children. Folate can be found in green leafy vegetables, but studies have shown that assimilation is more easily affected in folic acid. The upper limits are about 1,000 micrograms. Johns Hopkins University in Baltimore, Maryland, released a study not too long ago showing that the risk of high folate levels in blood can double the risk of autism. Next, we have 150 micrograms per day of iodine, typically in the form of potassium iodide. Iodine is important in the production of thyroid hormones that regulate the development of the fetal brain and nervous system. 450 milligrams per day of choline. That number increases to about 500 milligrams for lactating mothers. Choline is needed for proper brain development. An average diet contains maybe about 280 milligrams. So you need about 200 milligrams in a supplement form. If you cannot find a prenatal that contains choline, eggs are an excellent source, typically containing about 150 milligrams per egg. Legumes would be another good choice. Next, we have vitamin D requirements, which are between 1,000 and 4,000 IUs a day. Additionally, iron needs go up during pregnancy to about 27 milligrams a day. Red meat is an excellent source of iron, and thiamine and riboflavin requirements go up by about 50%. Long-chain omega-3 fatty acids, such as DHA and EPA, are also an excellent supplement to add. Essential fatty acids are neuroprotective and help make up the cellular membrane of every cell in your body. They increase the cell-to-cell communication and decrease inflammation. And they're crucial for growth and development in infants. Studies show that getting enough omega-3s during pregnancy to be associated with decreased premature birth, reduction in allergies, higher intelligence, better communication skills and social skills, and fewer behavioral problems. Decreased risk of developmental delays, as well as decreased risk of ADHD, autism, and cerebral palsy. And then finally, we have vitamin C. Increases slightly during pregnancy, but increases even more during lactation. Lactating mothers should get about 120 milligrams a day. Mothers that are having trouble producing adequate enough milk for your baby, studies have shown that vitamin C intake of 1,000 milligrams a day can increase milk production. Expected mothers often ask for my recommendation for a high-quality prenatal. It's my belief that a whole food supplement are always the best way to go. After all, you can't improve on God. Whole food supplements are full of synergistic compounds, both known and unknown. I'll post a link in the description below to a few high-quality whole food organic prenatals that meet the above nutrient requirements. Now that we know what to put in your body, it's time to talk about what to prevent from getting in your body. I'm talking about environmental toxins that we're all exposed to on a daily basis. Reducing your toxic exposure, thereby reducing the developmental baby's toxic exposure, is critical. The Environmental Working Group, which is a nonprofit organization, has detected nearly 300 chemicals in placental cord blood that contaminate the blood of the babies before they're born, when the brain, nervous system, and other organs are vulnerable to trace amounts of toxicity. Choosing safer home and body care products is the first place that you make a significant change. Many products use buzzwords like natural or gentle when they're anything but. I would highly encourage you to go to cosmeticsdatabase.com. I'll put the link in the description below. And search your cleaning products, which include things like detergents, glass and surface cleaner, as well as your daily cosmetics. The Cosmetic Daily database put on by the Environmental Working Group will give you a breakdown of the risk associated with the various products, both listed and the ingredients that are not required to be disclosed by law. They have a database of over 70,000 personal care products. I would also encourage you to read the recommendations on pesticides in food. You want to eat organic when you can, especially with what is known as the dirty dozen. These are 12 foods that retain pesticides residues more than other foods. They include things like apples, strawberries, grapes, celery, spinach, sweet bell peppers, cucumber, celery, tomato, snap peas, and potatoes. Find a good veggie wash and soak your produce before eating it. If you can't find a veggie wash, a recent research study from the University of Michigan and Amherst suggests soaking them in a solution of baking soda and water. You want 1 teaspoon of baking soda to 2 cups of water. Soak for a minimum of 2 minutes. Now, the study went on to say that it took a total of 12 to 15 minutes in the baking soda solution to completely get rid of pesticides. So the longer you can soak them, the better. Next, let's talk about the physical changes. As your baby begins to grow in the womb, an estimated 85% of women experience back pain during pregnancy. Finding relief without use of medications is almost always the best route for the healthy mom and baby. Even over-the-counter medications can be risky to take before and during pregnancy. Why? Well, all medications have side effects, and these are often heightened during pregnancy. For instance, a drug like acetaminophen has been linked to a greater risk of ADHD and asthma in children. Likewise, NSAIDs, non-steroidal anti-inflammatories, have been linked to a 59% increase in the risk of miscarriages. Fortunately, these days more and more women are discovering the many benefits associated with chiropractic care during pregnancy as well as during labor and delivery. During pregnancy, the hormone relaxin is produced to help loosen the joints and ligaments of the pelvis to best prepare the body for birth. Relaxin not only relaxes those ligaments in the pelvis, but also stretches other joints and ligaments all over the body. This is one reason why pregnant women develop back pain or sciatica pain, which is pain that runs down the leg. As those ligaments become loose and the body's center of gravity is pulled forward by the growing baby, which in turn increases the curve in the low back. A woman's low back can become overstressed by these biomechanical changes that increase the amount of stress on the low back, often leading to pain. In addition, the uterus and ovaries are directly innervated by the T12 nerve root, while the cervix and structures below it are innervated by the S2 nerve root. The implementation of chiropractic care as part of a treatment protocol during pregnancy may reduce the likelihood of in utero constraints and the associated risks after birth. A 35-year study published in 2015 in the Journal of Pediatrics concluded that children delivered by cesarean section had significantly increased risk of asthma, systemic connective tissue disorders, juvenile arthritis, inflammatory bowel disease, immune deficiencies, and leukemia. The reason being is because when the baby comes through the birth canal, it's inoculated with the mother's bacteria in the vagina. In addition, the contraction of the uterus muscles and the vaginal muscles will stimulate the neural activity of the brain. Chiropractic care throughout pregnancy removes the interference of the mother's nervous system, enhancing the baby's development in uterine function, in balancing her pelvis, eliminating undue tension to the muscles and ligaments, and enhancing optimal fetal positioning. Chiropractic care offers the possibilities to help increase the chances of vaginal delivery and the safety of delivery. Low-force chiropractic spinal adjustments are considered a highly safe, effective, non-invasive, and evidence-based option for women to find relief from pregnancy-induced back pain. In addition to the direct influence to the nervous system displays, it also controls the distribution of hormone to reproductive structures through the hypothalamus and pituitary glands. A recent study found that patients who received care from their OBGYN and chiropractor together versus their OBGYN alone had greater reductions in pain and improved quality of life and reduced labor times in the first time moms by up to 24%, and women who have multiple births by an average of 30%. What's more, an amazing 90% of women reported a high level of satisfaction with receiving chiropractic care during pregnancy. So it's no wonder that chiropractic is one of the most popular and organic healthcare choices for expecting moms. Welcoming a child into this world is a special event, and no decision in that process should ever be taken lightly. It's essential to understand and respect the body's natural ability to navigate this process. Knowing this, The World Health Organization recommends 4 care practices that promote, support, and protect the normal birth process. Number 1, let labor begin on its own. In many cases, inducing labor can increase the risk of complications for mother and child. Number 2, move and change positions during labor. Moving around can help labor progress and may shorten the total labor times. Number 3, bring a loved one or a doula for support. Labor support has shown to reduce the likelihood of cesarean section and improve the birth experience. And number 4, avoid interventions that aren't necessary. Continuous electronic monitoring hasn't been proven to provide any better outcomes for baby and may even increase the risk of getting a cesarean section. Pregnancy is a special time in a woman's life and a unique time for the body. The changes that help guide a successful birth process can also wreak havoc on a woman's back and joints. If you or an expected mother you know are looking to find natural pain relief solutions, give us a call. We're happy to evaluate you and work with your birth team to provide a non-invasive, safe, effective care that can help keep you active throughout all 3 trimesters. I'm Doc Scott, and I'll see you next time for another episode of Research That Matters TV.